High blood pressure is often called the silent killer because it can quietly damage many organs long before any symptoms appear. Most people know that uncontrolled hypertension can affect the heart, brain, and kidneys, leading to severe long-term complications. But very few realize that it can also damage one of the most delicate tissues in the body, the retina, at the back of the eye. The retina contains thousands of tiny blood vessels that nourish the cells responsible for the vision we rely on every day. These blood vessels are among the smallest arteries in the human body, making them uniquely vulnerable to internal pressure changes. Because of this, they are extremely sensitive to long-standing high blood pressure, even when you feel perfectly fine elsewhere. When blood pressure remains uncontrolled for months or years, the retinal arteries gradually become thickened and narrowed. As the vessel walls lose their natural elasticity, the essential blood flow to the retina becomes compromised, starving cells of oxygen. This chronic pressure leads to hypertensive retinopathy, a condition where the retina is damaged by the very blood meant to sustain it. In the early stages, doctors observe silver wiring, or copper wiring, where arteries reflect light differently due to wall thickening. As the condition progresses, we see AV nicking, where thickened arteries compress the underlying veins at crossing points. Eventually, leakage of blood and fluid may occur into the surrounding retinal tissue, leading to more severe manifestations. One common sign is a subconjunctival hemorrhage, a bright red patch on the white of the eye caused by a burst superficial vessel. Inside the eye, we may find retinal hemorrhages, often appearing as flame-shaped or dot and blot bleeds within the retinal layers. Cotton wool spots are another critical finding. These are small, white, fuzzy patches representing areas of localized tissue death. Hard exudates, which are deposits of fats and proteins, can also form, sometimes creating a macular star pattern. Severe hypertension can lead to swelling of the optic disc, known as papilledema, which is a medical emergency. The retina is the only place in the human body where doctors can directly see living blood vessels without performing surgery. That means a simple, non-invasive eye examination gives us a unique window into the true health of the body's entire circulation. Many patients are surprised to learn that an ophthalmologist may be the first doctor to suspect their blood pressure is uncontrolled. Unfortunately, hypertensive retinopathy often develops silently, with no pain and no obvious warning signs for the patient. Most patients continue to see normally during the early stages, unaware that their vascular health is deteriorating rapidly. By the time vision actually becomes blurred or distorted, significant and sometimes irreversible retinal damage may already have occurred. This makes the eye exam not just a check for glasses, but a vital health screening for your heart and vascular system. If you experience sudden vision loss, severe headaches, or eye redness, you must seek urgent medical care immediately. These symptoms can indicate a hypertensive crisis where the pressure has reached dangerous levels throughout the entire body. Controlling your blood pressure through medication, diet, and exercise is the most effective way to prevent permanent vision loss. This is why regular eye examinations are extremely important for every patient diagnosed with high blood pressure. Your eyes are the window to your health. Don't let the silent killer take your sight or your well-being without a fight. Protect your vision and control your pressure. Schedule your comprehensive eye exam today. It could save more than just your sight. Although many patients with hypertension have no symptoms initially, the retina often begins showing signs of damage much earlier than the patient realizes. During a comprehensive eye examination, the ophthalmologist carefully evaluates the retinal arteries, veins, optic nerve, and macula for changes caused by high blood pressure. One of the earliest signs is narrowing of the retinal arteries. As hypertension persists, the artery walls become thicker and lose their normal flexibility. The arteries begin reflecting more light, giving them a brighter appearance known as copper wiring. In advanced stages, they may appear almost white, a feature called silver wiring. As these hardened arteries cross over retinal veins, they compress the veins underneath. This phenomenon, known as AV nicking, disrupts normal blood flow. This compression increases the risk of retinal vein occlusion, where blood stagnates and pressure builds, leading to sudden vascular blockage. When blood pressure remains poorly controlled, the tiny blood vessels begin leaking. Small retinal hemorrhages appear as red spots across the tissue. Damaged nerve fibers become swollen, producing fluffy white patches called cotton wool spots. Leakage of fats also forms yellow deposits known as hard exudates. If leakage occurs near the macula, the part of the retina responsible for sharp vision, fluid accumulates and causes macular edema, resulting in blurred vision. This can result in distortion of straight lines, difficulty reading, and a significant reduction in central vision that disrupts daily life. In severe hypertension, the optic nerve may swell, a condition called papilledema. This is a medical emergency indicating dangerously elevated systemic pressure. The eye examination usually begins with checking vision and measuring eye pressure, as glaucoma can often coexist with hypertension. After dilating the pupils with eye drops, the ophthalmologist examines the retina using specialized lenses and high-powered microscopes. Fundus photography captures detailed images of the retina, allowing for critical comparison during future visits to determine if the disease is progressing. When swelling is suspected, optical coherence tomography, or OCT, is performed to create high-resolution images and accurately measure retinal thickness. If abnormal leakage is suspected, retinal angiography uses a special dye to identify blocked blood vessels, leaking capillaries, and areas requiring treatment. Modern retinal imaging not only protects vision, but also provides valuable information about the severity of hypertension throughout your entire body. The eye often reflects the health of the heart, brain, and kidneys long before other symptoms appear in those vital organs. Remember, early detection can save more than just your vision. It provides the data needed to manage your overall cardiovascular health. Stay tuned for Part 3, where we will discuss the serious complications, critical warning signs, and essential steps for prevention. In this final part of our series, we examine the long-term consequences of uncontrolled hypertension and the critical steps you can take to protect your sight and your life. While hypertensive retinopathy is a condition of the eye, it is also a powerful indicator of damage happening elsewhere in your body's vital systems. The most direct complication is permanent vision loss. Chronic leakage and swelling can lead to irreversible scarring of the macula and damage to the optic nerve. Patients with advanced retinopathy are at a significantly higher risk for stroke and other major cardiovascular events, as the eye reflects the health of the brain's circulation. Recognizing critical red flags is essential. If you experience sudden blurred vision, severe headaches, or new floaters, you must seek immediate medical attention. These symptoms can signal a malignant hypertensive crisis, a life-threatening situation where your blood pressure has reached dangerously high levels. The good news is that most of these complications are preventable. Managing your blood pressure today is the single most important thing you can do for your eyes. Adhering to your prescribed medication schedule is vital. Even if you feel fine, staying consistent with your treatment keeps your vascular system stable. Dietary changes, such as the DASH diet, can significantly lower pressure. Reducing salt and increasing your intake of leafy greens supports both heart and eye health. Regular physical activity strengthens your heart and improves the elasticity of your blood vessels, reducing the strain on your delicate retinal capillaries. Coupled with lifestyle changes, annual comprehensive eye examinations allow your doctor to monitor your progress and catch any early signs of vascular damage. By combining medical management, lifestyle adjustments, and regular screening, you can effectively silence the silent killer and protect your sight for years to come. Thank you for joining us for this series on hypertensive retinopathy. Your health is in your hands, and it's visible in your eyes. Protect your vision. Control your pressure. Talk to your doctor about your eye health today. High blood pressure does not usually cause pain in the eyes. In fact, many patients with hypertensive retinopathy continue to see normally until the disease has already damaged the retina. That is why waiting for symptoms before getting your eyes examined can be a costly mistake. However, there are certain warning signs that should never be ignored. If you experience sudden blurring of vision, sudden loss of vision in one or both eyes, or new floaters, you must act. Symptoms like flashes of light, distortion of straight lines, a dark curtain over your vision, or double vision require immediate ophthalmic evaluation. These may indicate retinal vein occlusion, hemorrhage, or detachment. Early treatment in these critical hours always yields the best results. Fortunately, the most powerful treatment for hypertensive eye disease begins long before surgery. It begins with controlling your blood pressure every single day. Take your prescribed medications regularly. Do not stop them simply because you feel well. High blood pressure causes silent damage even when there are no symptoms. Follow your physician's advice regarding salt restriction, weight management, regular physical activity, and stress reduction. If you have diabetes or high cholesterol, these conditions must also be well controlled as they further increase the risk of retinal damage. Smoking damages blood vessels and greatly increases the risk of vision-threatening complications. Quitting is one of the most important steps for your eyesight. Every person diagnosed with hypertension should undergo a comprehensive baseline eye examination, even if vision appears completely normal. This allows your ophthalmologist to document the condition of your retina and detect subtle changes long before symptoms ever develop. Depending on your condition, your doctor will recommend a follow-up schedule, whether annual exams or closer monitoring with OCT imaging. Remember, the retina is more than just tissue for vision. It is a living window into the health of your entire circulatory system. Changes seen inside the eye may provide important clues about the condition of your heart, brain, kidneys, and blood vessels throughout the body. Modern medicine provides remarkable tools to detect retinal disease early and treat many complications before permanent vision loss occurs. Remember, the retina is more than just tissue for vision. It is a living window into the health of your entire circulatory system. Protecting your blood pressure today is one of the best investments you can make for preserving your vision tomorrow. If you or your family have high blood pressure, don't wait for symptoms. Schedule a comprehensive eye examination today. Early detection and good control can protect both your eyesight and your overall health. Thank you for watching this series on hypertensive retinopathy. Stay healthy, keep your blood pressure under control, and remember, healthy blood vessels mean healthy eyes. Protect your vision before symptoms begin. Contact our specialized hypertensive eye evaluation center to schedule your visit. This video is intended for public education and does not replace professional medical consultation.
For appointments, contact R. Nadara, 93795 12374. Ramanagara 7019 412265. Kengeri 91483 16772.